Dr. Tom has offices in Santa Rosa, Napa, and Maui. You can also conveniently find him online all the time, 24 hours a day, 7 days a week, at drtomcosmetic.com. You can also call 707-542-8346, and that is where you can book a free consultation for whatever you are looking to do to improve your life and how you feel about yourself. And of course, Dr. Tom is voted by you Best Cosmetic Surgeon for 8 years and Best Aesthetician for 3 years. You can also nominate Dr. Tom and his team again for the Press Democrat Best of list. So be sure to call and book a consultation today, Dr. Tom. We're going to talk about getting summer ready.
Yes, we are, Michelle. Thank you. And I always want to make sure that I give a shout out to Michelle, who's our program director and fills in as our host and basically does everything for us. Michelle's been wonderful to work with. I've been working with Michelle since she was a little girl working here. I don't even know if she was an intern. I know she just got hired when she was very young and into this wonderful radio station family of radio stations. And so we're very lucky to have Michelle here. Today, actually, I'm going solo, Michelle, and we're going to be talking about what to do for getting ready for summer. Yeah, I think it's a great time just driving over here to the new studios here on Mendocino Avenue. It was hot outside.
Really?
It was actually hot. I had my air conditioning on, and I was thinking that maybe summer really is right around the corner.
Oh, I know. It's been so lovely to have a break in the rain, feel the weather start to warm up, albeit not maybe every single day, but we're getting there, and that's a good reminder that there are things that we can do so when it is nice and warm, we're wearing less clothes, we want to look good.
Absolutely. And so people are kind of, we notice that the phones are ringing a little bit more, and I think that we're after tax days, hooray, and so hopefully you all got refunds. I didn't, but I hope you all got refunds, and so the phones are ringing a little bit more, and people are kind of getting ready for summer. So I think one of the first things and that people are starting to look at is they know they're going to be starting to hit the beaches, or they're wearing shorts, or they're in the bathing suits, they're hanging out at the pool, either at the public pool or if you're lucky enough to have your own pool. And so they're starting to get ready for that. And it's something that I didn't think much about, Michelle, as I was growing up, but a lot of ladies, they have to shave a lot before getting out to the pool. And so that kind of raises a whole nother level of concern or anxiousness on their part. And along came this wonderful treatment called laser hair removal, which has really just made life so much easier for our patients. And a lot of women who, and again, how would I know? I'm not shaving, okay, but they're shaving and getting ready to put on bathing suits and so forth, and they will complain either of the irritation or the necessity of having to shave.
Right.
But a lot of them, I guess, and I didn't know this, Michelle, is that they would get irritation at the hair follicles and even develop sort of breakouts in that area.
Oh, wow. Okay. Yeah. It's just one of the things that you do when you're getting swimsuit ready. But are there options then with you that you said laser hair removal?
Laser hair removal is
how
actually,
effective is
yeah,
this?
it's a great treatment. So just very quickly to always go back to the science of it. So with laser hair removal, what we do is we use a laser, and a cold gel, which helps to soothe the skin, where we're pulsing the skin, the area of our concern, where you have a lot of hair growth. And what happens is that the follicle of the hair will absorb that laser energy like a dark shirt on a sunny day. Just like me, I have a blue suit on and being in my car, and I felt like I was heating up because it was pretty warm outside and it was pretty sunny. So what happens is that those hair follicles will then absorb that energy. They'll be damaged because they've absorbed it, if you will, in excess. It damages the hair follicle, and you end up with long-term hair reduction. I won't say it's permanent, because our hair is growing at different rates, and what was really funny, I remember learning that even in medical school, was that we look at the hair on our head, for instance, and we think all of our hair follicles are working, but maybe only about a third of them are actually active. The others, there's another third that's kind of going into the quiescent phase, quiet or hibernating phase, and about a third are in the hibernating phase. So our hair is growing in these different phases or cycles, so you have to do a number of sessions, and usually it can be anywhere from 4 to 6 weeks apart, and you're doing typically about 4 sessions, Michelle, to try to get the hair growth at as it's cycling through on your skin at the different phases, because it's most effective laser hair removal when it's aimed at actively growing hair. So for the protocol for our patients is to come in for 5 treatments. Usually that lasts the patients a long time. If you're really hairy in an area, then that can be an issue, either just your ethnicity or just a particular area, maybe medications that you're on, your hair is growing a lot. It may require more treatments in the future, not necessarily a series of 5, but it's something where you might do occasional maintenance sessions with laser hair removal.
Okay. Can I ask, does it matter what color your hair is?
Absolutely, you can ask. And so with laser hair removal, what I would say is that the perfect candidate is Snow White. Okay, and the reason it is because her skin's white, and so it doesn't absorb any of the light energy, it just reflects off of it. And she has dark hair follicles because she has black hair, so that's perfect. So people who have darker hair are the best candidates and light skin are the best candidates for laser hair removal. If you're a little bit darker skin, sometimes we'll put you on a bleaching agent so that we can kind of quiet your pigmented cells, your melanocytes, and that way we can safely treat your hair follicles and reduce the hair. If unfortunately, and I'm getting at that age where I'm getting a few little gray hairs, definitely, I'm pretty lucky that I'm not all gray, but you get some gray hairs. Unfortunately, gray hairs are not responsive to laser hair removal because they're white and the follicles aren't dark enough to absorb energy. So obviously the blondes and the redheads are not going to be as effective with laser hair removal reduction as with the darker brunettes and black hair patients.
Okay, all right, great. So you mentioned that there's a couple of sessions that you would do. What does it feel like to have it done?
So I had it done many years ago. Okay, and that's oh my gosh, that was in 1999. So when I opened up at the time, it called the Aesthetic Laser and Vein Center, and now we're called Dr. Tom Cosmetic Surgery as we have evolved. But it was pretty funny because I would go around, and these were first level lasers, and we were looking at all the different types of lasers, and so I got subjected to having these treatments, because I wanted to see what it felt like on my leg or on my arm, okay?
Right.
And I had to make sure, because I'm Chinese and Greek, that my skin wasn't tan when I was doing this. And so what I'm going to tell people is it feels a little bit like a rubber band snap. And I think that's the best way to do it. It's very tolerable. For some people it's a little bit more uncomfortable, but for most people they can handle it. Women tend to be, I know this sounds chauvinistic, but women tend to be tougher than men.
We are tougher than you, Dr. Tom.
You totally are. You totally are tougher. And if it really is an issue, one thing that we have now available at Dr. Tom Cosmetic Surgery is a system called Pronox. And Pronox is a combination of oxygen and nitrous oxide, or otherwise known as sleeping or laughing gas,
laughing gas,
laughing
okay.
gas,
Yeah.
exactly. And so it's a combination of oxygen and nitrous oxygen and nitrous oxide, excuse me. And so it's actually very safe. And in fact, they allow women who are in labor to use that to help to decrease the pain of labor. And in fact, even I know I only have one grandson, and my beautiful daughter-in-law, I know that they had offered, the OBGYN team had offered that to her while she was going through some of the more difficult parts of labor. So it's very, very safe. And we do have that available at Dr. Tom Cosmetic Surgery. So if you're finding that it's just really uncomfortable for you, you have an option, but most people don't need to do that, okay? Maybe guys, if they're getting their backs treated, it can be a little bit tougher. Me being, again, mostly Asian, God, I'd love to have some hair on my chest, and guys are getting it lasered off. I don't understand that, but, we always want what we don't have, right? So if it is uncomfortable, you can use our combination of oxygen and nitrous oxide, and that is called our Pronox system, PRO. NOx system.
Okay, very good. One more question. Now, you said that this reduces hair for the season, right? So is this something that you'd have to do then next summer season to get ready again?
Okay, so great question in terms of basically what you're asking me, is this permanent? And
Right.
I mentioned the fact that it's not, and a big part of that is because our hair grows in different cycles. And so if we have the perfect science of being able to know when each one of your hair follicles is going to become activated to start to grow, and then we zap it with the laser, it could be potentially permanent. But we don't have that accuracy, so we know we're humans, our hair grows at different rates. You probably will have to have some touch-up sessions. So let's say you sign up for a series of 5 right now, and in fact, I know that right now we just announced it actually in one of our newsletters, where if you purchase 4 sessions, you get the 5th one free. So that's a 20% reduction in cost. So give the office a call if that's something you're interested in. It's a great reason to give them a call. You don't have to go necessarily a year from now through another session of 5, okay? In other words, you might just need 1 session. And again, it may be, let's say your ethnicity, let's say you're Mediterranean blood, I'm part Greek, okay? And so for women, especially let's say on your face, okay, right now we're talking about getting ready for summer in the bikini area, but I'll tell you, laser hair removal is, Michelle, for women who have a lot of hair on their face, it is life altering for them, because they have to go and hide. They may have to shave it in the morning, sometimes even at night, and it doesn't make them feel very feminine. So laser hair removal can just be life altering for them in a positive way. They may have to, after they go through a series of 5, and because it's so significant and the hair growth may be a little bit more aggressive, maybe they have to come in and do a couple of treatments a year, okay? But again, it depends on a lot of factors. But for most people, they usually get some many good years of hair reduction, absolutely. And so if you're thinking about, hey, you know, I'm ready to head out to the beaches, or maybe just to the swimming pool, local barbecues, and you're thinking that you'd like to reduce hair in the bikini area, under the arms, that's a very popular area. Women who get tired of shaving under their underarms, having laser hair removal in that area can, again, it can make a big difference in just the quality of their life.
Wow, that's great. All right, well, this is not the only thing that we wanted to talk about, because there's lots of things to think about with summer and getting ready. So let's talk about for the face. What kinds of things should we be trying for the face?
Okay, so we talked about laser hair removal for the body. That's one of the things that you can do. Very simple procedure to do. Give our office a call if you're interested. And then let's move on to the face. So now we are just kind of coming out of what appeared to be a super long winter, didn't it, in Sonoma and Napa County. Oh my God, it was crazy. It seemed, and I'm a Michigan boy. I didn't move out here for cold weather, okay? And so, you know, we seemed like we had cold weather, rainy weather. We might get a touch of spring, and then we got hit with cold weather again. So we're indoors a lot. We have sometimes external heating that's going on, just living everyday life. We still do get some sunshine being in Northern California and the pollution. Our skin becomes congested, okay? And especially as we get older, our skin turn around, okay? So our skin, like our hair, constantly changing in different growth phases. Our skin over about a 3 to 4 week period of time starts off as very immature or youthful cells, if you will, and then it continues to move up to the surface, Michelle, and what happens is, as those cells move up to the surface, they die off. And so when we look, it's so funny to think of this, but when you look at your skin on your face, the top layer actually are dead skin cells, okay? But and that's okay, because it protects us. They're full of keratin, it helps to protect our body. But when that builds up too much, Michelle, it becomes congested. And so because of that congestion, our skin begins to look dull, doesn't look very fresh, begins to look aged, not youthful. So as we are now going to be, you know, we're heading into spring, heading into summer, and we really want to have that more youthful, fresh look, right? Spring's eternal, right? One of the best ways we can treat that is actually with a chemical peel or with a skin peel.
Okay, so tell us about the VI peel. It sounds like it's for very important people.
Yeah, I know. I love the name. It actually stands for Vitality Institute peels, but it's VI peel, and so of course we play off of that, because you're right, it's for very important people, but that includes all of us. All right. So with the VI peel, it's a combination peel, and I'm not going to get too technical, but there are about 3 important components to this. And it's one of our most aggressive peels, yet it is probably the most comfortable peel to have. I've had it multiple times. I love the VI peel. In fact, I got myself rescheduled with actually Faith, who's our patient coordinator and has been on the show with us, and she's also an esthetician. And of course, we have Hillary, who leads our esthetician services, and has done that for me as well. But with the VI peel, it doesn't hurt or doesn't burn going on, because they're actually called acid peels, right? Chemical peels.
Right.
And so that sounds really scary, and I try not to use chemical peels or acid peels, just call them peels. But indeed, chemically, that's what they are. And so people think of stinging when it goes on and so forth. And I have to tell you that it's related to what we call the pH, and they can adjust that as they create or they compound the VI peel. And if you get to the right pH and so forth, it can actually be a very comfortable peel. And personally, for me, I don't feel any stinging at all when I have the VI peel applied to my face. Now, everyone's different, so if you feel a little stinging, I don't want you to think that I was misleading you. Right. Everyone is different. But it's interesting, we have a lower level peel, one of our entry level peels, Michelle, and that one actually stings a little bit more.
Huh,
all right.
Interesting.
So
okay.
if your skin is right and you need an evaluation, it's just not something, even if you call and say, hey, Dr. Tom said, get my skin, summer ready, spring ready, and I want a VI peel, but you haven't been in the office in a while, we'll say, we want you to come on in. We do want to do a consult. And it's not because we want to waste your time, but we want to make sure that the VI peel is appropriate for you. And for most of us, it is appropriate. And so what you would do is you'd come in, of course, you would wash your face before you'd come in, no makeup, please. And then our esthetician, Hillary, she would absolutely do a deep cleansing of the face to make sure that we get all of the pollutants off of your face and so forth. And then at that point in time, she would apply the VI peel on the face. And as I mentioned earlier, Michelle, it is very comfortable. The VI peel is very comfortable. And so that's applied, okay? And then they're evaluating your skin as they're applying the peel. So it's just not a robotic, let me put 3 passes on your face. They're evaluating each time they put on a layer of the VI peel. How is your skin reacting? Are we seeing what we would call frosting? See a little frosting, which means it's effective, or not. Should we be a little bit more aggressive? Should we put on another peel? So you'll be constantly evaluated for this as we're applying the VI peel to your skin. And again, even if they're putting on multiple passes, maybe after multiple passes, maybe around some areas, maybe high in the cheek area around the eyes, maybe a little bit around the mouth, you might feel that's a little bit spicy. But again, and I'm a weenie, Michelle, so if I can tolerate it, anyone can tolerate it, and I find it to be very comfortable. So they complete the procedure, and then we just give it some time, and while the peel is affecting your skin, okay, and then they can neutralize it for you afterwards, and you walk out, and you can kind of carry on with your daily activities. We don't want you to go to the gym or go do some high intensity interval training with that. We don't want you sweating and so forth immediately afterwards, but you could go back to work. You could come into KSRO and do a show. In fact, maybe you just gave me an idea as we're talking about this, Michelle. Maybe what we'll do is I'll do one, or we'll have you come in and do one, and then we can come on in and we can talk about what it feels like, and then kind of take our listeners through the different stages. So you do the VI peel, you go home, and you're looking at yourself, and you're thinking, geez, I don't see anything yet. And you're right, you don't see anything yet. Then later on, and a whole kit is given to you with great instructions, and they even have a perfect website which tells you what to do. So if you forget, like me, my mind's racing in all these other different directions, you can actually go onto the website and it will tell you each step along the way. But you'll wash your face, and then we apply some retinol on our face, and you're going to do that for about 3+ days. If your skin gets a little bit irritated, there's also a hydrocortisone ointment that's included in this with the peel, and you can apply that, which helps to soothe the skin if you're somebody who is a little bit more sensitive. I tend not to need it as much, okay? And of course, sunblock. You want to do sunblock. You can absolutely do peels in the springtime. You can do peels in the summertime, but you have to take the appropriate precautions. You don't go out to the beach and sit out in the sun with a reflection, surface
well,
right
no one
under
should
your
really
face.
be doing that anyway,
You
right?
shouldn't be doing it, absolutely. But you just especially don't want to do that after a peel.
Yeah.
But then you're going to be doing these home treatments, and even on day 1 and 2, you're kind of thinking, geez, is there much difference here? And you're thinking, there's not. Hey, Dr. Tom, what's going on? You said this is a great peel. You love it. Day 3, you still might, every once in a while I get a little text message or I'll get a little social media on Messenger, and they'll say, hey, I had a VI peel with Mary or with Hillary and I'm not seeing much. And I always write back and say, give it another day or 2. And then usually the next day they write back and say, oh, now I'm seeing changes. So what happens is you don't notice anything for the first 2 or 3 days, okay? And then after that, you start to look at your skin, maybe on your cheek or on your forehead, maybe around your mouth, and you're getting to see the skin change a little bit like when we might, in the old days, when I might get sunburned, and you notice that on your shoulders, and then you see the skin kind of drying out, right? And then it's gonna start to peel, and that's what you see. So normally it's about day, I'm going to say 4, 5, 6, that you begin to see the real peeling. And I have to say it's really exciting. First of all, one quick cautionary note. If you see it peeling, don't start peeling it yourself, grabbing the skin.
Right.
That's not good. You let the natural process occur. Okay. That will give you the best results and safest for your skin, so you don't develop hypo or hyperpigmentation changes.
Right.
In other words, post-peel pigment changes, okay?
Okay.
Not very common, but you don't want to run out in the sun if you have a peel, and you don't want to be peeling with your fingers the skin. Let it kind of come off on its own. And what is so exciting, Michelle, is that you can see the fresh skin underneath your pigmented old skin. So yes, some of it does come off a little bit like a snake at times, and but I love it. Mary, our lead nurse at the office, has a saying, and her saying is, if you're not peeling, you're not trying, okay? So it's important to peel because you want to get those good results, okay?
Yeah. So how long does that peeling time frame?
So it's different, it's patient specific,
right.
But I'm going to say that maybe about 3+ days
okay.
that occurs. Initially you see a little bit maybe on that very first day of peeling, which is about day 3 or 4, and then you start to really see the peeling for the next 2 days, and then it kind of just slows down. And for most people, I'm going to work. I'm not interfering with anything. You just kind of carry on with life. It's not something you want to do just 3 or 4 days before your wedding,
right.
or before,
okay,
let's say, summertime, it's high school reunions.
Right.
You want to give yourself at least a couple of weeks beforehand is what I would say. But it is remarkable, the rejuvenating, youthful look that you will have, that clean, fresh look that we all want to have as spring and summer comes around.
Is that new skin, as it comes forth, is it more sensitive to the sun?
So it can be more sensitive to sun because you don't have that congested top dead layer of skin, and so you do need to put on sunblock. That's really important, Michelle. Thank you. I know you were kind of leading me in that direction. Sunblock is really important. You want to protect your investment, you want to protect your face, and sunblock means putting it on multiple times during the day, especially in the summer, although I do that all throughout the year because we live in Northern California and it's sunny all the time. Even when it's cloudy, it's still sunny, and we're getting exposed to the rays. So you do want to put on sunblock. And I think it's a great way to start the summer is a VI peel.
All right, excellent. We have about 4 minutes. Okay. Would you like to talk about Botox and Dysport?
Sure. So so we've talked about laser hair removal. That's getting swimming pool and beach ready with our with bathing suits, and other areas can be treated, of course. We talked about doing the VI peel to have that fresh skin so that we're looking ready for the springtime and the summer. And now what else can we do? Something that I was thinking quick things that we can change in terms of treatments getting us ready for the summer. So Maybe it's been a long winter. Oh my gosh, I just got done doing my taxes, and we've been frowning a lot. Okay, we're looking tired, or we're looking as if we're just not happy. So doing a little Botox or Dysport, which helps to soften muscle movement in the frown area between the eyes, what the kids call the 11s. And if we can treat that area, that opens up our eyes, which I need with my Asian ethnicity, 75% Asian ethnicity, and my eyelids tend to hang down a little bit. Doing Botox and Dysport between our eyes helps to open up my eyes, make me look happier, make me look approachable, make me look like I'm ready to have a good time come spring and summertime. So I absolutely would recommend Botox and Dysport in those areas. In terms of filler, sometimes a little bit of filler just to add a little bit to the cheeks, kind of plump up the cheeks, give us that fresh look is good. And I know a lot of times for ladies, a little bit of filler in the lips just makes putting on lipstick look a little bit better, kind of gives them that little bit of pizzazz, getting ready for the summer.
And getting ready for smooches.
And getting ready for smooches. That's right. I know that was a real important question for you. When you get filler on the lips, do people notice that? And I will have to say that I don't get complaints from the patients or their boyfriends or girlfriends, okay?
Very good. All right, can you give us a quick recap of the different things we can do to get summer ready?
Absolutely. So getting ready for summer, getting ready for the putting on bathing suits, laser hair removal, not only around the bikini area, but also underarms. Fantastic treatment. In terms of having that fresh skin look for spring and summer, the VI peel. I think that is a great treatment. And if it's not just right for you, come and talk to our professionals, because we might be able to use a little bit of a lesser peel for you. And then finally, hey, Dysport and Botox to kind of stop that frown so we can look like we're happy and smiling. That's fantastic. A little bit of filler to plump up the cheeks, a little bit around the lips to be more smoochable, as you would say, Michelle.
Exactly. And always remember your sunblock. Very important.
Absolutely. 100%. Thank you for saying that.
All right. Well, it's always fun to chat with you, Dr. Tom. And again, I remind listeners, the best thing to do is to call for a consultation. Figure out what your plan of attack is going to be. Call him at 707-542-8346, 707-542-8346. You can also go online to drtomcosmetic.com.